Bismillah ar-Rahman ar-Rahim, my dear students at Ajman University. I would like to welcome you to the second part of drug information resources. In my last presentation, we talked about tertiary resources, and today we're going to talk about secondary literature, and then we are going to talk about primary literature, and then we'll talk about other resources. Let's start recalling what do we mean by tertiary resources. These refer to information that you might find in textbooks, in general internet websites, some type of review articles like narrative reviews, compendia, BNF, British National Formulary, USP, United States Pharmacopoeia, etc. When we talk about secondary literature, we mainly means references that either index or abstract the primary literature. الجول تاعها, the main goal of secondary literature is to direct the user to the primary literature. Usually these are databases that index or abstract the primary literature, which are of course usually published in journals, periodical journals, and this will allow the user who use such database, secondary database, in order to be directed to the required primary literature. Okay. Now, this is the main secondary literature. Another type of secondary literature is, if you remember, we talked about systematic reviews. Systematic reviews. We said that we consider them as secondary because they contain many bibliography about specific topic. يعني it contains many references about specific topics, so it will allow the reader to get to the primary literature if needed. Okay. Okay, then what do we mean by indexing and abstracting? These two terms are different. When we say indexing, it means it's just like when you write a reference. In this reference, you write the author's name, you write the name of the or title of the article, you write the journal name. This is what you write in the reference. Okay. And indexing, it means that, okay, which provide bibliographic information about a citation. Okay. While abstracting comes from abstract, and it means a summary, and this summary is always accompanying the primary literature. So if you have an article that is primary literature in a journal, after the title you will see the section of abstract where everything regarding the research is summarized there. Okay, so this abstract or this brief description will be also used in the database to help you when you want to search for the article. It's very important to know that there is no one database that can cover all the journals. Okay, maybe with the exception of Google Scholar because it's kind of open, but there is no one database that covers all the journals and their articles. That's why it's necessary for you, in order to do a comprehensive search, to use more than one database. Suppose you want to prepare a review article, it's as I told you previously, maybe you need most journals will require you to do systematic reviews, whether qualitative or quantitative, and in that you will have to determine the databases that you are going to use. So you should not use just one database and depend on that, because you'll be missing some information may be available in other databases. Okay, now these databases are primarily available in the electronic format. Okay, يعني you access them through online, through a website. Occasionally, a few times, some of these databases will have also hard copy. This hard copy, if you want to buy it, maybe it's less costly than, for example, subscribing to the database online. Because if you buy one copy, it will be covering maybe quarter of the year, or maybe it's annual, it's 1 year covering just 1 year. Okay, so maybe it's cheaper for you compared than subscribing to the database, which will allow you to access many years before and after the year of interest. So maybe you are interested after 2010 and before 2010. Okay, so if you want just to buy 2010, the hard copy may be less costly for you, but if you subscribe, it will allow you also to access articles after and before the time, the specific year that you want. Okay. Now, one of the disadvantages of printed sources, اللي هو hard copy, is that when someone wants to do a search, only one user at a time can do that, because you cannot have two people doing the search on the same hard copy or printed resource. While if that is online, then it will allow multiple users. Another disadvantage is that if you want to browse new information that comes maybe every day or every week, then online resources get updated more frequent compared to printed resources. That's why maybe the subscription for online resource is much better in this case. Okay, now what is or how do we use? Now what you need to do is to be able to use these databases that you see. Okay, now how do you do your search? What are the challenges that you might have? طيب, one of the challenges is that the terms are indexed maybe in different ways for different databases. For example, when I say acetaminophen or paracetamol, okay, maybe the terms are different. If you are going to Europe, they use paracetamol. If you go to USA, they use acetaminophen. That's why what I mean to tell you is that the terms that are used might be different from one database to another, and you might need to be familiar with these terms. That's why if you want to do comprehensive search, then you need to use all the possible terms that are given. Otherwise, you might be missing some information. One of the most important, and I usually use that, اللي هو PubMed, which is run by the National Library of Medicine. And this library uses Midline. Okay, Midline is a database for journals and their published articles. Okay, and in this PubMed, they use what we call medical subject heading terms. Okay, إذا في هناك specific terms. يعني what I mean to say, إنه when you, for example, you want to publish an article, the midline or the PubMed, they will take this article and they will classify it. Okay, they will put it under certain terms. So if someone wants to do a search, if they want to locate these articles, they must use those terms that are available in medical subject heading. And I will give you an example. I will show you that في PubMed. So this is Google. So if I go to PubMed, if I click here, okay, see here you have medical subject heading database, and the benefit of that, you can locate the articles, specific articles, you can locate them directly if you are using medical subject headings. That does not mean that you cannot use PubMed directly. So if I click here, medical subject heading database, just for you to see it, see here it's mesh or medical subject heading. And let's say you want to look at a particular side effects from flu vaccine. So if I write flu vaccine, see here, this is the flu vaccine, and I'm looking at allergy. Okay, طيب شوفوا هون, this is flu vaccine. Now you will see here that they have subheading, okay, where you can add it to flu vaccine. For example, adverse effect. Okay, here you have other terms that you might accompany that. So adverse effect maybe is the best choice. You will see also how the hierarchy, how they arrange the terms. So here, see all mesh category. بعدين under that there are chemicals and drug categories. Under that there is complex mixtures, biological products, vaccines. Okay, تحت الفاكسين في viral vaccines. Under the viral vaccine you have the influenza vaccine. Okay, and let's say we are looking at the adverse effects. Here I can say add to search builder. Okay, شوفوا هون شو حكى. Now I need influenza vaccine, I need the adverse effect. Okay, I can here also add مثلا allergy. Okay, because I need allergy. Okay, there are many types of allergy. Here one thing is hypersensitivity. Okay, so I have to pick up that. Okay, so actually I can here add to the search, okay, the hyper sensitivity. I can add that. See, it's now influenza vaccines, adverse effect, and hyper sensitivity. All, you will see that all of them are in mesh. Now I can search the PubMed using mesh, using medical subject heading. So if I click here, search, see here it will allow me to narrow down the results and get specifically the results that I need. Okay, otherwise, if what we can do is if we clear all this, okay, let me go to PubMed again. PubMed. Okay. Okay, let me type PubMed just to make it faster. Otherwise, I can type these things here directly. And one of the things that I can do is, for example, I can write. Let me write another term: diabetes. Diabetes type 2. Okay, and then I will do search. But what I can do also, I can do several other things. See here, I have 155, over 155,000 results. طيب, I have to be more specific, and I have to control my search in a systematic way in order for me to get to my document without the risk of not finding some of the important results. That's why we have the advanced search. In this advanced search, I can use diabetes type 2, as you see it here. Okay, but now what I can do is I can choose where do I want this to be. Okay, is it in any place in the article, or I need it in a certain or specific places, like for example the title. فإذا كان, if it is in the title, for sure the article will be talking about type 2 diabetes. So what I can do is I can choose the title here, or, and this is what I recommend usually, if I want to focus on certain information, I will use title and abstract, because in the abstract they will not mention diabetes type 2 unless it is part of the study. So let me add it. So now it's being added to my search, and I need diabetes type 2, and it should be there in the title and abstract. I can further include another thing that I may require, such as insulin. I want, for example, this to be related to insulin. So I want type 2 diabetes, but it should be with insulin. So I will use and. You see here and. See the choices I have. I have and, I have or, I have not. طيب, let me explain to you the difference between these three. If I choose and, إذا استخدمت and, this means what? It means that in the title and abstract, because here I'm choosing also title and abstract. In the title and abstract, both diabetes type 2 and insulin, okay, will appear either in the title or abstract or both. Okay, if I use or, شو بصير? If both are available, the article will appear to me. If one of them is available, برضو the article will appear to me. It means if I use or, I will have a lot of articles, but in some articles there may be talking about only insulin. In some articles they are talking only about diabetes type 2 without insulin, and in some articles both of them will be there. فإذا if I use or, I will get more results, but it might not be specific لإيش, to my requirement, to what I'm searching for. If I use and, it means both of them should be there. Okay, and this makes my search more narrow. I'm narrowing my search now. So I want insulin and diabetes type 2 to be ish, to be either in the title or abstract, both of them, insulin and diabetes type 2. طيب, the third one is not. If I add not, if I choose not, then what will happen? It will give me all articles that has diabetes type 2, all the articles except the articles that is accompanied by insulin. يعني if in article there is also insulin, it will not show me that. Okay, it will not show me that article. فإذا not will reduce the results, the number of results of the previous one. يعني if I just do a search now only with this one, I will get, let's say, as I said previously, 155,000, but it was general search. Okay, now I am narrowing this by, okay, I want them to be in the title or abstract, and now I'm narrowing this further. I wanted it must be with insulin, يعني insulin must be there. Okay, so in this case I will add and. In case I don't want the articles that talks about insulin and type 2 diabetes, I will use not. what will happen? It will reduce the number of results for diabetes type 2. If I use or, it will increase the number of results because it will give me articles containing diabetes type 2 or articles containing insulin or articles containing both. So for in this case, I want both of them. I want to see, for example, when do they give insulin to diabetic patients type 2, or the trial with type 2 diabetic patients taking insulin, etc. So I can use and in this case. شوفوا هلا between brackets there should be both type 2 diabetic patients وinsulin. Both should be there either in the title or abstract or both. Okay. طيب, now I will do a search, and now you will see, because I have chosen title and abstract and I have chosen that it should be with insulin, see the number of results. Now I clicked on search. Now see, from 155,000 I got it down to 408, and this is what we do when we want to do a review article on a certain topic. طيب, additionally I can specify many things. طبعا here it will show me how the publication, it was increasing, and since 2018, after 2018, it started to decrease. Here I can say show me even if it has abstract, show me only if it is a free full article so I can read it all. طبعا if you choose free full article, it means you are omitting so many important articles that are not free. Okay, so usually I will leave that. Here طبعا what you see here is for filtration. Also, for example, you want in the last 10 years, or maybe you want in the last 20 years. طبعا usually if a subject is hot, it's a hot topic, then usually we focus on the last 10 years. شوفوا هلا from 408 now we have 240. If I want to focus on clinical trials and randomized clinical trial, I can do that طبعا. And شوفوا it's going to even decrease the results even further. And there are additional filters. I can, for example, say, oh, I don't want anything related to dental journals or nursing. I only want the midline, اللي هي biomedical sciences, which includes pharmacy as well. I only want from this. I can also limit to language. Article type زي ما حكينا clinical study or clinical trial phase 1, phase 2, phase 3, etc. I can limit it to age. فإذا all of these can help me to focus my search, for example, when I want to write a systematic review or review something specific. Okay. Here it's giving you an example. For example, you want to know if is clonidine effective in the treatment of attention deficit hyperactivity disorder, ADHD. فvery important here طبعا in adolescent صار عندنا age. إذا شفتوا, if you remember, when additional filter includes age. Okay, so I can limit that when I do a search. طيب, additionally here there are three important things. First, the population is adolescents. Okay, مراهقين يعني. The drug is clonidine. The disorder is ADHD. Okay, شوفوا انه sometimes the كترم لما if you remember medical subject heading, كterm they consider adolescent as pediatric or as children or the opposite. Okay, فإذا this can differ from one database to another, and you need to know about that. But if you do a general search such what we did here, title abstract, here I'm not looking for medical subject heading. Okay, I'm just searching the title and abstract, or I can search the whole article. Okay, I can choose the whole article for that, so it can be anywhere. طيب, so what do I write? I need to write clonidine and ADHD. Okay, then I can limit it to adolescents group. This is one of things I have to do. Remember the and I talked about, and or and not. These are called Boolean operators. Boolean operators. Okay, so what are Boolean operators? They are and, or, not. And you already learned about the function of and, about the function of or, and about the function of not. Here in this figure it shows you the results. If I say that two things must be there, yani this one and this one, both of them must be in the results showing us the articles containing both terms. شوفوا where they intersect. This one, the results will only show me this. يعني when this drug is alone, is not with the when this, for example, clonidine and ADHD. Okay, clonidine may have a lot of researches done on clonidine. ADHD, there are a lot of researches on attention deficit hyperactivity disorder. Now, but both together, see, when they are both together appearing in the journal, it's just only this portion. So see, and it is decreasing the numbers that I get compared than if I do this alone and I do this alone. Now, or will give me everything, this and the intersection and this one as well. Not, see, if I don't use not, I just use the term clonidine, it will give me the whole results. But if I say not ADHD, then it will remove the intersection. So it's decreasing now. So it not decreases. If I use not, it will decreases this one. It's going to decrease it. Okay. طيب, this is what you need to learn, and you will have some few example here. See, for example, guanfacine, clonidine, and ADHD. What if I want them three? All of them must be together. وين بتقاطع? Where do they intersect? شوفوا, it's this part here. It's this part. Let me show you the part where all the three will intersect. Okay, see this part? It's this part. Okay, it will show me only this results. Okay, so you need to be familiar with how you're gonna do the search. Okay, some database, but not the PubMed, because I showed you in the PubMed they have only the Boolean operators and or not. But some database will include the term with or near. So instead of and, بدل ما يستخدموا and, they will use with or near, but it has specific indication that when they use, for example, clonidine and ADHD, Instead of that, they use clonidine with or near ADHD. It means that these two terms must be close together. يعني clonidine and ADHD must be within certain number of words. وبالتالي you are assured that both are related to each other, because what can happen is that clonidine may be at the beginning of the page and ADHD maybe it's not, they are not talking about clonidine, and maybe it's at the end of the page, so they are not related to each other. So you are losing some you are wasting some time while doing a search, because you will find articles where both are there but they are not in combination. They are not talking about clonidine effect on ADHD. What you need them, you need them to be close to each other. So in the article they are related to each other, and that's when you will use with or near. As I told you, we can limit the search by year, by the language of publication, by the type of article, and as I told you, by the type of journal as well. Uh, I already told you that you might need to use different terms when you do search, and you need to avoid misspelling, because sometimes misspelling will give you zero results. So you need to be sure of the spelling. Example of databases اللي هي عندنا ال evidence based medicine reviews that are available في Cochrane library. طبعا these are mainly reviews, but because they are very strong, and usually what happens, certain experts will review literature, primary literature, regarding a medical treatment, okay, where there is a debate about it, and these Cochrane reviews, they provide very strong evidence for therapy. They are of very high quality, okay, اللي هي Cochrane reviews. وهاي by the publisher اللي هو Wiley and Sons, John Wiley and Sons. Another database اللي هو Embase, it's by Elsevier, and it covers many journals, more than 9,000 journals, in addition to Medline اللي هي في PubMed اللي هي عن طريق by the government. It's supported by US government, the Medline database. In addition to the Medline, they have other journals, especially those which are of international, يعني from different countries, China, India, etc. So they have wide coverage of journals. Google Scholar is very nice because it's free to use, and Google Scholar allows you to locate the article that you want. Okay, but the problem with Google Scholar, if I go to it, because you might use it as well. See Google Scholar. Okay, here, for example, I can say diabetes type 2 and insulin. Okay, and I can do a search. The problem with Google Scholar that طبعا you can filter so that you only get, for example, from 2011 to 2021. You can do that. Additionally, it has an advanced search. So if I go here, and here I have advanced search, and the only thing that is allowing me here is, for example, I can choose whether it should be exactly the same words, ولا it can contain such words. بعدين anywhere in the article or in the title. See here they don't tell me abstract unfortunately. Okay, يعني advanced search here is less convenient or less useful compared to PubMed. So for example, I might choose, okay, I want this to be in the title and it should contains all these words. Okay, I can remove and if I like. Okay, and then do a search. Okay, so this is another way, but as I told you, the filtering and the advanced search is not as good as in the PubMed. Something good about Google Scholar that it is not only about biomedical sciences such as pharmacy or nursing or dentistry. It covers all aspects of research. في عنا we have also the International Pharmaceutical Abstract. It's the only database that focus on ايش pharmaceutical fields. And IPA اللي هو International Pharmaceutical Abstracts is maintained by the publisher Clarivate Analytics, and it's available in some databases. يعني some databases they use IPA in addition to others, in addition for example to Midline. Midline, which is very important, it's maintained by the National Library of Medicine for USA government, and it's a part of the PubMed. It's as well part, طبعا it's the main part of PubMed. يعني PubMed mainly uses Midline. كمان if you remember we talked about Embase. Embase also uses Midline, but with greater coverage of international publications compared to Midline. Okay, this is a case you don't have to answer it. You can look at it if you like. Now we want to talk about primary literature. When we say primary literature, does it mean it has to be published? It has been published? No, it doesn't mean that. It can be on the notes. Einstein might have written something on his notes that is something new. That's why we call it primary, but he did not publish it. Okay? When we say primary literature, as I told you, it's mainly in periodical journals, and it represents the results of new work, novel work. So it can be, for example, controlled clinical trial, cohort studies, case series, case reports. طبعا these studies, or these types of studies, we will talk about them inshallah later as we go on through the semester. It can also include in vitro experiments. It doesn't have to be about humans. It can be animals or in vivo or ex vivo, whatever. Okay, but it represents new results and maybe new methodology. طيب, what are the advantages of primary literature? For the primary literature, which is, as I told you, it's mainly in journals, usually it contains detailed information about a specific topic. For example, someone is assessing whether valsartan will be beneficial in the condition of atrial fibrillation. Okay, so someone did this trial, and then someone published this trial as controlled clinical study, and then you will be able to access all the information, such as what was the control they used, how many subjects were involved, what were the results, was the method used accurate or not accurate. So detailed information will be there for you to assess and verify whether the results are applicable or not, or the method used is good or not, etc. فإذا detailed information will be available to you. Also, primary literature tend to be more recent. Okay, يعني anything new will be published as primary literature. That's why anything new you will find it في primary literature. Okay, طبعا before that it is possible that you might hear it on news. يعني someone got a, يعني something innovative and they got it on the news before he was able to publish this thing. طبعا the disadvantages that you need to be aware of. Remember when I said that detailed information will be available, which will allow you to assess the utility and validity of the study. Because actually some authors, they may have misleading conclusions. And therefore, حتى even when the study is there, a primary literature is there, and there is evidence, you should not just take it. Remember when I told you any health information is false unless proven to be correct? Not only that, but what is the benefits? What is the magnitude of this effect? That's another thing you need to look at. So the disadvantage that there can be misleading information, conclusion, and you need the skills to do the evaluation. Here you need to assess utility and validity. How will you be able to do that without the skills that inshallah I will be trying inshallah to install this in you, so you have these skills. Okay, and this will happen as we go through this semester. As we progress through the semester, you will learn these skills and you'll be doing assessment by yourself. Even when you have good skills, still you need time, not to evaluate just one publication or one article. In order to take decision, you might need to evaluate several articles, and this will need some time, of course. How do you obtain the primary literature? طبعا there are different ways. One, it might be available freely في الانترنت. This is one way. Okay, the journal is having an open access articles which you can access freely. Or when you find in the PubMed, when you do the search in the PubMed, it will tell you whether this is free and you can access it or not. The second thing, you can go to the library, your library, Ajman University Library, and you might find actually the journal available with them. Another thing is your library, and this is a fantastic thing that we have at Ajman University, and I'm really proud of our library and Mr. Abdullah, who's running the library. If you need any article, you can, there is through the systems, through the library system, you can ask the librarian to get it for you. Okay, so you can get any article that is not available. Otherwise, you can go to the journal website and pay them money, which can be $30 or US dollars or $40, something like that, in order to read the article. So there are different ways to obtain the article. Now, after finishing the secondary and primary sources, now we're going to talk about others. The internet nowadays are really a good point to start searching, especially about something that is unusual. Okay, for example, a new disease, you didn't hear about it. So where do I start? Go to the internet, Google it, and you will start to get some information. Or sometimes I may be asked about a product, over-the-counter product, OTC product, or combination of dietary supplements. طبعا if I don't know what is this product and what does it contain, I cannot respond to the patient and tell him whether this will be effective or not. I need to know what is inside them. So, for example, GABA plus. What is GABA plus? I don't know. So, in this case, I will type GABA plus and then I need to know what are the ingredients inside GABA plus to see whether it will be beneficial in ADHD, for example. Another thing you can do is to contact the manufacturer. Okay, you can go to the website and the GABA Plus manufacturer will give some information about the ingredients inside the GABA Plus, which will allow you to see whether these ingredients are helpful in ADHD. Or you may refer to news agencies, okay, news wires, okay, where anything new they will publish it. Okay, so طبعا if you go to the news they will not contain everything, and you should be careful because if I, for example, I remember at least couple of cases, at least in the television they had an interview with between brackets or quotation well-known scientists, okay, and I have seen this on TV, claiming false health information. Okay, for example, that they found therapy for diabetes type 2, just pay $300 and then you will be cured. Or lately I heard about, and this is on TV, and it was announcement and breaking news, okay, that by the use of ozone therapy you'll be able to get rid of COVID-19, which is a simple procedure, etc., etc. And all these things were not substantiated by good evidence. طيب. Also, as with the databases that will direct you to primary literature, even the general search through different search engines, remember that they use different techniques to identify the web pages, which means it's better that you use more than one search engine, not just Google. Try something else, although Google is very powerful, and Google Scholar is geared toward scholarly content. It's very important, if you remember when I said that, especially the internet, the false or incomplete health information is more than the true ones. Here, it's very important that you assess the quality of the website. Someone will tell me, but how will I know? How do I know that this website is telling the truth or might be expected to have something of good quality? في هناك some principles, but again you will need to do the investigation. Let me give you some tenets. Okay, one, usually educational institutions will only provide good quality drug information or health related information. There are also non-profit organization. Okay, مثلا في عنا organization, we have organization for diabetes, we have organization for gastrointestinal disorders. Okay, طيب, هاي non-profit organization and usually headed by someone expert in the field, and what you will see is usually of good quality. A website that belongs to the government will not cheat its people with health information. It will give them usually good quality health information. طيب, فإذا these are the things, but it's not just enough to say, okay, it means otherwise everything is false. No, There are other things you need to consider. For example, you remember when we talked about HON, or health on the net, and this is an organization, okay, while organization will assess and evaluate your website if you apply for that. Only if you apply, it will evaluate your website, and if it contains quality information, then you can add their logo. Other criteria is that you have to find by yourself when you read the website. You need to have some sense of judging whether, oh, they are trying to promote a particular treatment or product, and oh, why they are trying to promote it, why they are trying to give so many claims about this product. Okay, do they have interest in that? Okay, are they asking for money? uh, is the content accurate and current? طبعا you will need to judge that. Okay, did they provide links to other websites that are not affiliated to them, so you can check such information? Does it have detailed references? يعني whenever they claim something, they give you the reference, and these references are strong. You can refer to them and you can check the information. Who wrote the information on the website? Is it an expert? Can you identify the author who wrote the website? Is he expert? Can you contact him? So several things that you have to bear in mind. انتبهوا, always pay attention. You know, sometimes someone will tell you, I'm just saying this for God's sake. I'm trying to help you. Try this, try this. All these things are not accurate unless proven to be accurate. Okay, they will consider them as false unless proven to be accurate. Remember this. Other resources, as I said, the news story, sometimes contacting the manufacturer, and you will see this, sometimes seeking an expert in the field. For example, let's say there is a new drug for hypertension. I can contact a cardiologist to ask him about this. He probably have some information. I can go for organization that is related to a disease state. For example, like diabetes. في عنا association for diabetes, which is very powerful organization. I can contact the manufacturer, as I told you, and ask for maybe information that is not published, and they can provide me that with. For example, I'll tell you an example. Let's say the manufacturer is only manufacturing tablets, okay, and you want to prepare a suspension from this tablet, but you don't have any information regarding that. You might contact the manufacturer and ask the manufacturer if they have any information regarding how to make a suspension or a liquid preparation out of these tablets. What is the expiry date, etc. We have some information that is geared to customers. يعني their level and the education they provide is at the level of the customer. And what they found is the following, and I want you to be aware of this, that behind the physician and the pharmacist, يعني خلف الدكتور والصيدلي, behind the physician and the pharmacist, the most common way for customer to find information is through internet. إذن it is possible that they will bring you information from the internet regarding a particular disease or condition, etc. For example, pregnant women, they may ask you about what they should do they are pregnant and what they should do, what drugs do they take. They are afraid, they cannot drink coffee, they cannot drink juice, they cannot do anything because they are afraid. Pregnant women, they are afraid that this will affect their fetus. Okay, so you need to direct them to the proper resources in order to help them. And here you will see a list of such resources that will be beneficial to the customers. It's at the level of the customers. Okay, so here are the websites and information regarding the websites and what do they contain. So this is going to be really beneficial. You don't need to memorize these things, you just need to go through them for you to understand what are the different types of information that are available already over the internet and customers can refer to them. شوف مثلا هون office on women's health. Okay, شوفوا هون contains information about conditions and disease of special interest to women including drug use during pregnancy and lactation. In conclusion, it's not enough that you are able to retrieve information and access information. You should be able and have the skill not only to identify the resources and access them, but also to interpret and evaluate. يعني even the information that you see, you should not take it as it is. You should be able to interpret it in the correct way and evaluate this information as I told you. Okay, here there are some questions in case you like to go through them. I hope today's lecture was beneficial. As usual, if you have any question, you know WhatsApp group that we have with you. There is the email. There is the lecture time. Every lecture or every week we have a discussion regarding the topic that is assigned to you to read and the video that you watch. Okay, have a nice day and bye bye.